Hi, everybody. I'm Pam Kufahl with Club Industry, and I'm here today with Gale Landers, founder and CEO of Fitness Formula Clubs, and Stephen Schwartz, CEO of Midtown Athletic Clubs. Both are headquartered in Chicago, and both have been competitors for many, many years, but now the two are working together along with a lot of other health clubs to help get the health clubs in Illinois reopened after the COVID-19 related temporary shutdowns of health clubs. So as of today, when we're recording this, June 5th, the only health clubs in Illinois that are allowed to be reopened are those that do outside training or have outside facilities, and those that do one-on-one training. And there are certain restrictions, certain guidelines that are imposed on each of those facilities. So Gale and Stephen, thank you so much for joining us here today. We just kind of wanted to get a little bit of a rundown from you guys on, first of all, how the COVID-19 situation has affected your facilities and not being allowed to reopen yet, how that is affecting you. So, Gale, do you want to get started on how that's affecting Fitness Formula Clubs?
Oh, sure. I think many people know we have 11 locations, 8 in the city of Chicago proper and 3 in near-in suburbs. And I guess I would summarize it up, Pam, by saying we hit the negative grand slam here of challenges. So first we had the pandemic, and then followed recently, as you probably heard in Chicago, the protests and the looting. And in fact, one of my locations had to be boarded up, fortunately, before that neighborhood got hit even harder. Third, we're going into recession. And when we do get open, hopefully here in a few weeks, we're going to have the recession, the summer period, which is the slowest period of the year. So there's 4 bases. We're hitting all of them, but we're going to overcome them. But it's been a huge obstacle. But by the time we get open, it's going to be, if we get open by the end of the month or 1st of July, it'll be 3.5 months of zero revenue. We've laid off 1,100 employees. We did keep about 30 some on. And to that extent, we went on offense. So we made all of our improvements, our capital improvements, we expedited them for the year, and we're completing those now. So a lot of our members are going to come back. When they do come back, to see some clubs that look dramatically different than what they did when we had to temporarily close.
Great. Sounds like, yeah, there's a lot going on right now, even more than, just the COVID-19 situation, particularly there in Chicago and some other large cities. Stephen, how about you guys? How has this impacted Midtown Athletic Clubs? I know you have clubs around the country as well as there in Chicago and Illinois.
We have both Midtown Athletic Clubs, which are the large indoor-outdoor sports resort type places, and then we have Midtown Health, which manages corporate fitness centers and hospital wellness centers. And between the two, we have about 33 locations. We're in a bunch of different states. And we were 100% closed from March 16th or whatever, plus in Canada. And so we have a furlough of 98% of our staff. So about right around 2,500 people who've been laid off, and it just kills me. It's the hardest decision. It's not why I went into this business. We're a 3rd generation family business, and my dad and I have never, ever once in 50 years taken out a distribution. We've pumped out all of our profits back into the company to grow. And, so our retained earnings look good, but our cash position is slowly kind of dwindling as we try and keep what we have left alive. Sorry about the phone ringing. So, in fact, I'm going to just...
Business goes on.
Working from home is just a joy. We just opened 2 days ago, 3 to 5 days ago, a club in Ohio, and I don't have enough statistics yet to tell you, be of any meaningful information. But and we look to open our Atlanta and South Florida clubs mid-month. And Illinois is still, as Gale pointed out, Illinois has still got a lot of wild cards going on. Illinois is Chicago is one of the hardest hit places in the country, but downstate really isn't. And so, the mayor of Chicago swings a very big stick and is very cognizant of trying to keep this from getting worse, so we don't have a New York style situation. So I have empathy for that, but I think that we're chomping at the bit to get open, and there's a lot of jobs at stake, and we're working really hard to try and find a way to do that.
Right. And have you guys gotten any guidance on when you might possibly be allowed to reopen in Illinois? And do you feel
Yeah,
like
so
Chicago will be different from the greater state?
I had a conversation with the governor this week, and we talked about it. The state's been divided into 5 regions, but really the way he looks at it is very simple, and it's a public health policy point of view. From what he said to me was, there's epidemiologically a 20-day cycle between when the disease or an outbreak starts and when you start seeing it hit the hospitals in a large statistically significant way. So Illinois chose a 28-day cycle period to observe, which gave you a full 20-day impact and an extra week to make sure you're safe. So that's a pretty long period of time between phases. We're currently in phase 3. The restrictions are such in phase 3 that health clubs actually just can't operate profitably. Phase 4, as it's written, looks like it's going to be much better, but it's a bit of a moving target, and a number of us are on committees trying to help influence that. As Gale said, the protests this week, created a whole bunch of social gatherings. So we're going to see in 20 days. I guess the only good news is that the protests occurred right at the beginning of phase 3, which was going to be 28 days no matter what. So we'll have a chance to see it. Before the protests, I think it was looking very good that we'd be open and in phase 4 by July 1st. Now, I don't know. It's anybody's guess. He's watching what other states are going to do. We're going to make a presentation to the Illinois Department of Public Health to try and explain why we're okay and why it's unfair. The political unfairness issue, it's unfair that restaurants can be open and we can't, but that's not really the public health point of view. That's a political.
Right.
The public health point of view is just, here's how we can be safe.
Right. Well, what
So
do you...
the short answer to your question is 28 days.
Phase 3 started May 29th, ma'am. So
May 29th, okay.
the suburbs could, theoretically open if it stays with the 28 days by June 26th or 27th. And the city just started phase 3 June 3rd, which coincided with these protests and the looting and so on and so forth. What we're, really afraid of is this thing not only getting delayed farther, but actually lapsing back. And so our challenge is to try to broaden the definition within phase 3, so that if we do get open in phase 4, which hopefully we will, but if there's a relapse, how can we get the guidelines broadened so that they're much broader than what you defined at the beginning of this recording, so that the clubs can actually exist and keep their staff on board and have their members come in at a reasonable rate. Under the current phase 3 guidelines, that's just not possible. So we've been going down this. It's like we were on the 1 yard line, on your own 1 yard line when the pandemic hit. You're running through. You get through the line. You're past the linebackers, the safeties, the cornerback, and you see the end zone. And you're running and running and running, but the end zone just keeps getting farther and farther away. We've been backed up twice already with the dates, and so it's like we can't see the goal line. And are we going to run out of gas? Are we going to run out of protein and carbs? Are we going to run out of cash?
Right.
By the time,
cash being the only important one in that matter. Cash being the only important one in that equation, Gale.
And we're hoping landlords and banks understand that. So we're all working on multiple fronts with multiple banks, multiple landlords. Restructuring deals and processes is going to take a lot of cooperation from multiple entities.
In Midtown's case, Pam, we worked out with our banks, but the interest, the principal that they're deferring is not a significant number in terms of our operation. We have giant buildings, we have to carry them. There's utilities, taxes. So things can only go wrong in a building. There's stuff they have to repair. So you're on life support, but it still costs money. And there's no such thing as a business that can survive with no revenue. And
and then the flip side is, when do you bring your staff back? Because we're trying to, like Steve explained, we're trying to predict or anticipate when we're going to open and hopefully not have a relapse. But then, we also have several hundred staff to bring back, prepare in advance, train under the new guidelines and all the new stuff that we've bought for cleanliness and such. So it's a real puzzle. It's a real challenge, and we're all working through that.
Now, have you been, sorry, Stephen, I was just going to say, have you been told that you will open in phase 4? Or have you been told, that may not?
Phase 4 by Illinois standards and Chicago standards right now, and I want to point out that right now is a very big question mark.
Yes.
It looks like we'll be able to open and function in phase 4.
Okay.
And function and live, survive, not just,
right.
not thrive maybe, but survive.
Right.
Now, I think it's, what I'm learning with these alliance calls is that, the industry's exploded with boutiques in the last couple of years, as we know, and some of them are very small. And when you have 1,000 feet to work with, and you've designed your business on tightly packed classes, that becomes a very difficult, physics come into play. And if the physics are social distancing requires 6 feet, and they're not going to be liberal on that, then you just have you're limited by the walls.
Right.
Now, whether they're willing to relax the 6 feet, if there are other mitigating factors, ventilation, dividers, masks, it's very unclear. So I think that there's those people with business models that require very close contact have a tougher road to hoe with public health. But I also think the countervailing thing is, as time goes on, we're learning so much more about the virus, and it looks like it may not be as, the fear part of it has been overblown, and that the actual effects can be managed. There's lots of states now that are open for more than 20 days, and their curves don't seem to be radically spiking. Now, maybe they will, but if they don't, it kind of it looks like it's a more manageable situation. That's number one. Number two, people are not responding particularly well to being cooped up inside for this long. And so at some point, the social contract of staying in to protect everybody may not be maybe out of balance with the loss of jobs and the fact that maybe it's not as uncontrollably deadly as we thought. Yeah, so there's a lot of variables that I think we'll learn a lot more in the next few weeks,
right,
as the world opens.
The fear factor, Pam, is the biggest thing we face. We're just hearing it all the time from members. Everybody knows people are going on freeze. Some people are quitting. But that's the biggest thing. I think in general, for quality operators, the members generally trust the clubs, but their confidence level on a lot of them is really low, and that has to be rebuilt. So there's a whole big slice of everyone's membership that is, which spells profit, which are going to be delayed because people are going to go on freeze, are going to want to wait 2 or 3 more months, or so on. So overcoming that is going to be a big hurdle. So opening up properly, correctly, and not having clubs doing rogue things that backfire and impact all of us is a big fear we have, that someone's going to go rogue.
Right.
That will be, disastrous.
What we found in Chicago specifically, when we got to the goal line, to use Gale's analogy, when they were about to go to phase 3 and we had negotiated some looser terms, when it got to the highest levels of the city administration, they felt, what, the health clubs have been bad actors. In fact, a couple of studios had opened in defiance of the closure in Chicago in a public kind of a way, and that did not help, because they looked and said, listen, we can't trust these guys. Now, the facts are, no matter what we had said, phase 3, Chicagoans weren't really ready to come back to the club in any significant way. You could say whatever you want. There's just not enough people who are that excited about it. A couple of clubs could open, they'd be busy, but as an industry, they weren't ready. That's becoming less and less true with every week that goes by.
Right. People are more and more ready to go.
Yeah.
And feeling a little bit more comfortable now that they're going out in other locations and feeling safe. So what do you feel was the reason that health clubs weren't included in the third phase? I mean, what can you, as part of the Illinois Fitness Alliance, do to change that perception of clubs? I don't know if you want to take that, Gale, first.
Yeah, I'll jump in first. We don't have a strong voice of advocacy here. We weren't organized like the Restaurant Association, like the Merchants Association. We didn't have a voice at the table. So we're doing that now, and we feel that there's going to be strength in numbers. It's a long-term play, but we're also looking at ways we can activate our members and so on, contacting our aldermen. But even our index code, our tax code, we're coupled with casinos and resorts. I mean, that's crazy. But you don't change that with the bureaucratic process in 2 weeks, and all of a sudden get lumped in with the restaurants. But the restaurants here are opening, and I drove the streets of Chicago last night, and you'd never know there was a pandemic. They're not social distancing 6 feet. They're sitting in groups, and they're not, they're meeting friends and so on and so forth. So we got caught in the betwixt and between. But we're going to fix that.
Let me follow up on Gale's point. And Gale and I have been involved in IRSA and the public policy process for as long, and you say we're competitors, but Gale and I are also partners and we're collaborators. And the thing I've been telling everybody in our industry is competitors tomorrow, collaborators today. And cooperator, let's cooperate today, compete tomorrow. The IRSA's public policy effort, as measured by its budget, is not that significant. And it's not anywhere near enough to be effective in 50 states. And some of us have been saying that for 20 years. So it's nothing new. And to Gale's point, you can't just have a crisis and think that the switch flips on and everyone hears, oh, fitness is medicine and we should be essential and everything's going to be terrific. It just doesn't work that way. What we learned with PPP is everyone had the right intention to help small businesses, but when you got into the definition of what a small business was and the logistics of how it's going to happen, the government's not wired to respond that quickly and that effectively. We had no one at the table before that, like the restaurant and hotel people did, who have for years been pounding away and had a seat at the table. In Illinois, IRSA provided fact sheets for us, but getting that message out is not so easy. And by the way, in a pandemic, and then with a protest, violence, looting, the agenda gets moved very quickly to lots of different areas, which we're not a central player. There's 58,000, supposedly, according to the SIC codes, 58,000 fitness workers in Illinois. About 85% of those are in the Chicago area. If Paul Byrne is right, and a third of the clubs are going to go out of business as a result of this, and you have to think that a place like New York and Chicago will over-index because we are shut down the most, you're talking about 20,000 workers out of work in our state alone.
Right.
And it's not like, and we have great professionals and good people, but they're not like going to become software engineers tomorrow. And so, and all the other retailers are in trouble, so they're not going to get those jobs. So, this is a serious problem that has a couple different angles to it. The other problem is, if people go out now and don't social distance and they're congregating in restaurants and the curve goes up, it's going to be harder for us to open the next phase.
Exactly. So, you guys, we've been talking about a little bit here about the Illinois Fitness Alliance, but, obviously you all were seeing this problem and you all realized you needed to come together to help resolve this problem. How did this get started, and what's the main mission of this alliance?
Well, the mission is to, use our voice for all the fitness professionals within Illinois and to keep our state healthier and fit. So, that's the overall mission. Then we've established certain priorities about reopening, relief, recovery, and so on. So there's been a a small handful, and I really think, I thank Steve for pulling 3 or 4 of us together on different fronts and starting this thing in many respects. But we've, all of a sudden got, 50, 60 different club companies and operators that are galvanizing together, networking together, and coming up with best practices and figuring out how we're going to activate our members. We want to ignite them and get them involved, get them behind us, help us contact our aldermen and other government officials. So it's going to be a process. It's not going to happen overnight. And it's not easy. It takes a lot of time and effort, to put these things together, and a lot of calls while you're, trying to keep a business in survival mode.
Mm-hmm.
Gale got his group to make a list of all the clubs in the neighborhoods that we wouldn't normally, we're trying, one of the things that the mayor's position is social equity is important. You don't want to be opening the rich north side and neglecting the poor south side. So we're trying, we don't know. I don't know all the clubs in the city. It's just not something I do. And so Gale was busy looking up where are all the gyms that we don't necessarily know, who are friends, and where are they, and all over. And now how do we reach out to them and get them as part of the alliance? So we have a unified voice that's not just overweighted in the neighborhoods that we're most familiar with.
Yeah, we're looking at this, as you probably know, the south and west side, are challenged neighborhoods and often underserved. So we've put a spotlight on them, and we've found a good 100 plus, at least as of now, that we're going to contact. We want to invite them in to be members with us. And so this is going to be open up to health clubs, nonprofits, country clubs, park districts, corporations, hospitals, suppliers, other vendors, even retailers, commercial club providers of equipment, and so on. We want to make it as broad as possible so that it truly is serving the mission of all fitness professionals.
It's an industry. Life Fitness. Life Fitness is based in Chicago. Wilson Sporting Goods is in Chicago. Power Plate's in Chicago. Daxco's in Chicago. So there's a lot of jobs tied to, and economic activity tied to our industry based here in Illinois. And we're also, Gale and I are trying to find people downstate that, we're finding some of the people that we just don't normally run into.
Yeah, we don't bump into them. So, Steve and I will both tell you that we could probably run faster and harder, alone as individuals, but we know we can get a heck of a lot farther if we pull everybody together, and bike together as a group, and pool our resources and join organizations. Maybe at some point, who knows, maybe get a lobbyist, but at this point, it's the short-term angle that we're taking to get through phase 4 successfully, and hopefully have a backup plan for phase 3.
Yeah.
And that's what I wondered, up to this point, up June 5th is the day that we're recording this. What has the Alliance's efforts entailed so far? I mean, Stephen, you mentioned that you had spoken with the governor. Was that just as Midtown athletic clubs, or is that something you guys are doing as the Alliance, and are you meeting?
It started because just the mayor set up a task force and the governor set up a task force. Each one hired independent consultants. The mayor's group, city group, hired Boston Consulting Group. State hired Bain. They started reaching out for club operators, and we were doing some phone calls. Then the mayor set up a structure with 11 industry groups or 10 industry groups. One of them was the retail and other services industry group. They put health clubs and beauty salons as other services under the retail category. And the volunteer who was heading up the guidelines for the retail task force was the general counsel of the Illinois Retail Merchants Association. She's terrific. And so we had meetings after meetings with, not just me, but various club operators. As it turned out, the city kind of focused more with us. The state did a broader group of people. And sometimes public health will be on the call, sometimes not. And it's an uphill battle trying to explain to people why we're safer. People see us, look, if you are an asymptomatic carrier of the virus and it's respiratory and you're on a treadmill expiring, it's kind of logical to think that that's a potential problem. And that is a medical fact and political problem to oversee. People focus on the sweat and the touching. But when you really get down to it, it's the respiratory transmission that's a problem. The lack of scientific community. This is, you look, if I'm trying to avoid the politics of this, but by not having a strong federal CDC-based guideline, everyone is doing their own, playing their own music. And I'm operating in different states, and they're all different.
Yeah.
It could drive you insane.
Yeah.
And
we just,
so in Illinois, we're trying to get to one kind of a standard that makes more sense. It's just not easy.
Right.
I think I just add that in general, that, like as Steve says, not getting too political, but I think in general, there's a core element of lack of trust within our industry in how politicians see our industry. They, it's a very fragmented industry, so they've heard the horror stories, but many of them are members of our clubs, and they know that there are great operators and great clubs out there that we're incredibly community based. And what we do is we bring communities together, and we give a lot of back to communities, both financially and non-financially. But there's still this core element of that we're not at the level of other businesses. So, I mean, how does this measure that the liquor stores can be open? They're a core element.
I consider that essential business.
I'm sorry, but that just doesn't measure.
Well, the point I was making is you spend as much time in a Costco as you do in a health club, and you don't have a cleaner. This personal training, one-on-one training in Illinois is really about cleaning. It's not about training. And you don't have a personal cleaner walking around with you in Costco, everything you touch, spraying it down. So it's an unfair treatment that we're getting, and it's not necessarily logical. And so to Gale's point, we just don't have enough political weight at the table. And I know you got a lot of hot water recently, Pam, with your article with the people in California. I'm not taking a position, but our past does have some problems in it that needs to be open.
Yeah, I mean, Steve and I would put any of our clubs up against any Whole Foods, Target, Costco, any of those types of businesses in terms of cleanliness, or social distance, occupancy levels. I mean, occupancy levels, some stores don't even have anyone counting.
If you go to the Johns Hopkins Governor's Guide study that was originally done, you'll see it rates the risk factors by industry. I don't know if you've seen it, Pam.
No, I'll take a look at that.
It's worth you looking it up. If you want, after the call, I can send you the link. And museums have a higher potential risk factor than clubs, but they're opening museums first. So logic is not really dictating the day.
Right.
We just have to keep fighting our way up the hill.
Yeah, I think unfortunately you're judged by the worst among you. And so if the worst among you does something wrong, then the entire group is judged by that. And people see sweat and people see exhaling, a lot when you're running on a treadmill, and they just, equate that to danger, So it's this perception that needs to be changed about the industry and all the positives that people get from exercising. And while people have been exercising at home, there's only so much you can do virtually. You don't have the equipment in your home to use. So
life is not without some risk. And the question for these people is to balance what risks are worth taking. And I think that as some of the science comes out, you're going to see that health clubs that follow social distancing and sanitizing practices are the same as other places. It's not a greater risk. And at that point, the benefits far outweigh the risk, because it's important to people's mental health, physical health, and all the things that we were preaching to ourselves that we know are true.
Right, and immunity. And so is part of what you're trying to do also put together protocols that all clubs and Ys and studios in the state of Illinois could follow, so that you do have one set of protocols that you can show to the governor and the mayor and say,
guidelines that are reasonable, guidelines that we can live by. We can actually function until we get to phase 5, which presumably is going to be not until a vaccine or some other medical therapy. is available, and who knows how long that will be. So the guidelines have to be fair enough, reasonable enough, broad enough, so we can operate and get all of our members in on a regular basis. But, you know, we're basically starting a new life cycle of every club. It's like you're opening, for us, you're opening 11 new clubs, starting from scratch. I mean, the members you have equate to a decent pre-sale, or maybe better perhaps, but now you're opening day one after you've been shut down and you're just reopening again. It's like a brand new club.
Mm-hmm.
It's a brand new operation, and you're training all your staff in a brand new way.
Right.
Gale, I don't know your numbers well enough, and I don't know the industry's numbers well enough, but I would guess that our break-even numbers as an industry are somewhere around 75% of our normal membership.
I think that's pretty accurate, depending on the fixed cost of a given club. I think that's pretty,
Yeah, I mean, it's
pretty
good.
close.
So, you know, less
5 to
profitable
10%.
clubs, maybe it's a little higher, more profitable clubs, a little lower.
Yeah.
But if you pick 75 as an average, if 20% of the people are afraid to come back or stop coming back because they have gone virtual, or they just, you know, whatever reason, we don't have a lot of margin to fight for to stay alive.
Right.
Right.
Yeah,
and couple that with the ancillary revenues are going to take perhaps an extended period of time to ramp up, because you're starting that whole part of your business over again as well. And there's a whole social distancing component that's involved with that between the trainer and the member. So that's going to be a brand new experience, and getting people comfortable doing that. So it's multiple facets of challenge here.
Yeah, and that's a good point about the return rate, because Planet Fitness just announced this week that for its facilities that have been open for at least 2 weeks, they have a 60% return rate compared to this time last year. So, or usage rate, I guess I would say. So, you know, if you need 75% to be profitable, then you know there's a lot of work still that needs to be done.
75% as break even. Anything below that is costing you money. Anything above that, you're actually making some money.
Mm-hmm. Yeah.
And if you realize that a good health club over the course of its economic life needs to reinvest somewhere between 4 and 8% of its revenues on average
Annually.
Your break even for the long haul is really 80 to 85%. Now, what that means is, while you're open in this period, you're not going to spend your money reinventing your business, but you're deferring that actual need for capital to the future. So I don't want to get too complicated on it, but 75%, if 20, we've got an uphill battle to save these jobs.
Yeah, definitely.
And we talked to several other club companies, and they've got, you know, 15 to 20% that have either canceled. They're open, but they have 15 to 20% who have canceled or frozen.
Mm-hmm.
And it's not done yet. The wave isn't completely finished yet, because they haven't started billing in some cases, or they only billed a half of a month.
And look, you know, some guys are already back at 80% usage, and it's going to take a few months. But back to our Gale's point earlier about the goalpost, until you get started, you can't get started.
Right.
Get people.
You're still in pregame.
Yeah. No momentum. We need to get the momentum going. Pam.
Right.
It's actually a very delicate calculation that we all have to make as owners of our businesses.
Mm-hmm.
You're not going to open. It's unlikely that you're going to open and immediately be over your break even. So it may cost you more to be open than to be closed in the initial ramp up period. So there's going to be a giant working capital call for our industry. And there won't be any banks or governments most likely here to bail us out for that. So a lot of businesses will have trouble struggling with that. I don't know how much more they can lean on vendors, landlords, whatever. I don't know. Everyone's going to have, the CEO of your business is now going to be, is focused, our whole life is focused on cash and how do we get it and keep it alive. The analogy I make is, there's a brick wall. Our business is an airplane, and we're flying it into a brick wall because there's a day where we run out of money.
Mm-hmm.
And that brick wall moves around. Oh, they just decided Cook County to delay tax payments for real estate taxes from August to October. Okay, the wall just moved back. Yeah, but you open up and you have to give 2 weeks of dues to everybody and you're paying payroll. That wall's moving up. So,
Right. And then depending on your landlord, the wall can go forward or back too. But you have some landlords that are cooperating with you and will either defer rent significantly over a longer period of time, or in some cases may abate it, or in other cases, if they'll at least add it on to the end of the lease, move the wall back. So if you have a 2 years, 3 years left on your lease, add that period of time to the end of the lease, extend the lease. The money that we've lost, we're never going to get it again.
no.
Right.
You know, we've lost millions of dollars, and that money, if we have to pay the rent on top of rent, like, where's it going to come from?
Gale, that's an excellent point. That's like an unbelievably good point. I was telling my dad last night, I said, you realize it's going to cost, in our case, probably $10 million of investment for zero. Now, I'm not talking $10 million for new equipment or $10 million for a new club. It's just $10 million to stay closed.
Right.
Yeah.
That's brutal. That screws with a balance sheet.
Do you feel, though, that people are seeing their health and fitness as being more important now, and so that in the long run, you might recoup back, maybe not all that money, but you might get more members eventually because they're like, wow, I this is so important. Why wasn't I a member of a club before?
Pam, from your mouth to God's ears. Okay, we hope so. We hope so. But I mean, there is a lot of publicity on the value of a strong immunity system. I mean, that is a play that I think is going to strike home. I think people have had it up to here, staying home, eating at home, dealing with home challenges or issues, and they want to get out. There's no question. There is a tremendous amount of members who do want to get back to the clubs. Absolutely. We hear it every day. But there's the flip side of people who have this big fear factor that's been built up at a level. Forget about your political persuasions, but the press has made this into a gigantic hurdle to overcome in terms of the fear factor. Right. So that's something that we're going to have to work together as an industry.
I agree.
And as a part of the alliance, we'll probably something we'll work on together.
I agree 100%. It's a multivariable equation, Pam. There's some people who have now said, I don't need a club anymore. I can do it at home. I don't need a club anymore. I want a club, but I'm out of a job. Get back to Gale's recession comment. Or I'm going to change club categories. I was at a expensive club and at a less expensive club. Or I'm at a less expensive club. I now realize I want more from my club. I'm going to go up. Or I'm fat and slothful. I got to get out and do something. Or I just want to see people, and that's a good place to. I think you're going to see all those things happen.
Right.
Yeah. So Steve mentioned the on-demand workout at home possibility, the capability. So we have a really good on-demand program, and several hundred people have signed up for it. But so now we've all taught people how to do this at home. We've educated them, and so we do anticipate the vast majority are going to come back to the clubs because those are the early adopters. Those are the people who are actually trying as best they can, even within the constraints that they're living under. But we've taught them how to do this now. So I think a challenge for the industry will be to figure out how that can accrue to revenue and member retention. So there's
I'm actually a big believer that virtual will help us. I actually am. I agree. I started life, as you know, Pam, in the hotel business 45 years ago, and there were only like 3 types of hotels. A motel, a big convention hotel, and then like a commercial type of a hotel. Now there's like extended stay, suites, every kind of thing you can think. And the business just got bigger and bigger. Health clubs went from musclehead gyms to expanding to all different kinds of things. Boutiques, they're all terrific. And it expands the market in all these different ways. And so it becomes more of an omni-channel distribution. You can do fitness yourself. You can ride a bike. You can join the club. You do some stuff online. And I think that I'm actually very bullish on our industry in the long run, because this pandemic, if it does anything, it underscores the importance of your health. Gale's point about immunity, to our point, and it underscores the value of community. Our clubs do those things.
Yeah, exactly.
Yeah, Steve hit the operative word, long term. I mean, this is a long-term play. But we've, like the two of us, so many of us in this industry have been in it for the long haul. And this has been our careers, our businesses for decades. So this is certainly the most challenging component in the life of my company. I'm sure the vast majority of people would agree that figuring this out, it's like a Rubik cube that not only is turning and twisting, but it's also moving. And you're trying to catch it so that you can make the adjustments.
Right. Just a matter of how many people will be able to survive for that long haul until you guys reopen. So,
speaking of muscles that we've exercised, as CEOs, we've all been entrepreneurial. We've all had to learn how to manage people. We've had to learn the market, all that stuff. The muscle we've never exercised is the public policy muscle. We've never gone out and practiced talking to politicians as an industry and making ourselves relevant. Yeah. This is a broadside for us to understand that's a muscle we have to learn to work.
Yeah, we've learned a really valuable lesson here, unfortunately, because like so many states are upside down financially. And I think it's no secret that the one we're in is in that type of situation. So, how states are going to raise the revenue, if you will, to overcome their loss of revenue in this crisis, which is billions and billions of dollars. Mm-hmm. So we need to be prepared for that. And that's why we've got to have a strong advocacy as an industry, a broad-based component of our industry. And that's the goal here, to pull everybody together, to galvanize them.
Yeah, it's really seemed to be a maturation of the industry beyond what it was before. And I think ultimately that will be a good thing. So if somebody has been watching this and they're like, oh, I'm in Illinois, I want to be part of this, how do they become a part of the Illinois Fitness Alliance?
www.illinoisfitnessalliance.com.
Go to the website and sign up. We welcome all.
And what will they be? Right. Or what will they be expected to do once they're a member of this group?
So we worked on coming up with a dues structure today. It's not going to be very much money, but really we want them to sign on so we know who they are, come to the meetings by Zoom so they understand what's in good information flow. And then what we're really going to ask everyone to do, and what we think is the most effective short-term use of our resources, is for us to all reach out as individuals to local politicians and engage our memberships. We think local is the most important way to go right now. Mm-hmm. And we have a few people in our association who are talking to people at the top. Getting more people to the people at the top isn't going to be the solution. Getting more people to the people in the middle who can pressure the people at the top from within the power structure of the government is a much more effective. What I mean by that is, if everybody calling the governor's office isn't going to make any difference. We already talked to the governor. He's on board. He's just got to work through the bureaucracy. The mayor, we haven't really had a good conversation with the mayor. But the alderman can have a very important conversation with the mayor. And she has to work with the alderman and live with the alderman. The aldermen care a lot about their constituents. Mayors of small towns care a lot. County executives care a lot. And if we just keep pressuring them, that's how we get on the agenda. Mm-hmm. The city of Chicago has an economic development task force that's run by the deputy mayor. I sit on all the phone calls, and it's the union guys, the hotel guys, the restaurant guys, the retail guys, the manufacturing guys. They're all listening to all this stuff. And I ask a question every time at the end about where we're standing on the health, because I want them to hear we're not open.
Right.
I'm nice, but I'm a pebble in their shoe. As a result, they know we're here. And now we just need to get more political pressure on them to deal with us.
Right.
So Pam, we've been on several phone calls with the state of Illinois as well. They've hired Bain as their consultant, and in terms of establishing guidelines. And one of the things we're learning is that they're good people, and they're great listeners, but this stuff moves slow.
Yeah.
And there's a lot of hurdles involved. And so the point about what we've learned about, being late to the table and not having an advocacy group at the level we would like to have it, a few years ago, it's a painful lesson. But we're going to change it. We have to change it. So we anticipate having hundreds of members that are going to join. And collectively, I think it's going to work, but it's going to take time. It's not going to happen overnight.
Right. Great.
You know, the other thing is, we all want America to come back, right? You got to be open. And there's a lot of jobs at stake. And so they're going to open it up. It's just, you know, as Maynard Keynes says, in the long run, we're all dead. We just got to get there in the midterm and the short term.
Yeah.
We got to get open.
Steve just telling me he wants to make America great again. So.
Oh, shit. Don't start me on that, Gale. What you have,
Even
Pam,
you almost went through the whole thing without cussing.
I didn't even notice. Pam, what you have is the two opposite ends of the political spectrum here. So this is a balance.
Oh, well, they're not completely opposites. You know, I think we're more centrist than that.
People in Illinois are whatever. We're good. We're good.
All right. Great. Well, thank you both. I appreciate your time and all your insights and everything. And yeah, if anybody wants to join this, go to www.illinoisfitnessalliance.com and check it out. So thanks so much.
Thank you, Pam.
Thanks.